The Health Secretary Jeremy Hunt, the Shadow Health Secretary Andy Burnham, for the Lib Dems Norman Lamb, and for UKIP Mark Hanson. Jeremy Hunt first, why are you missing waiting times for cancer treatment?
Well, I think the first thing to say is that I lost my dad to cancer, and I don't think there'll be anyone here who doesn't have a loved one they've lost. And the story that we've heard from Paul is too common in the NHS. The figures that we heard about today are actually from 2010, and they show that even despite big efforts that I know Andy made, we have struggled to catch up with the European survival rates. And what everyone says is there are really two things: early diagnosis, catching people at stage 1, not stages 2, 3 and 4, and also better access to the latest cancer drugs. So we're now doing 500,000 more cancer tests every year. We've introduced the Cancer Drugs Fund, and we're on track this Parliament to treat nearly 750,000 more people for cancer than the last Parliament. I'm sure there's lots more to do, but I think we are beginning to turn the tide.
Andy Burnham?
I agree with much of what Jeremy's just said. The report also says, though, that this country made some of the biggest gains in cancer survival in the last decade, particularly in breast cancer. But as the gentleman said, early diagnosis is absolutely the new frontier if we are to really bring those survival rates up to European standards.
Paul's misdiagnosis was under the Labour government, so in a way your record was no better than the Tories.
Well, our record was pretty good, as the report says today, but I would acknowledge there was much further to go. And I think, as Victoria said, the reorganisation has thrown things off course. That was what Cancer Research UK said a few weeks ago. The NHS as a whole in the last year has missed the cancer treatment target, which is that people should start their treatment within 2 months. But
Jeremy Hunt was shaking his head.
We want to have more testing capacity in primary care to give people a guarantee of 1 week for tests and results, because we think that is the way you start to get better early diagnosis.
I think you have to, it is true, and it's disappointing that we are missing one of the important cancer waiting times targets, but you have to ask why that is, and the reason is because we have had a dramatic increase, 560,000 more cancer referrals every year. That does put pressure on the system, but what it actually means is that we are treating more people for cancer. Now, we can't be complacent, but I think we are going in the right direction.
Well, don't go anywhere, because just as the government's struggling to meet its cancer targets, it's a similar story with A&E. The NHS has missed its A&E waiting times target to see 95% of patients within 4 hours every week this winter. And the NHS in England has struggled to cope with rising demand. In the last 2 weeks of last year, over Christmas, more than 20,000 people waited more than 4 hours. That almost quadrupled from the same period the year before. From November to the end of February, there were 7 million visits made to A&Es in England, 190,000 more than the year before. And there were delays in discharging patients, 320,000 times, a rise of 29%. Well, Jeremy Hunt, when you go to the voters in May, those figures are going to be pretty hard to justify, aren't they?
Well, we have had real pressure in A&E departments. In fact, I did part of a shift in the A&E department here at Watford, and there's a gentleman in the audience who actually taught me how to wash beds. And I saw for myself, and actually I saw something that stayed with me and has stayed with me for my whole time as Health Secretary, which I think sums up the problem. There was a 90-year-old lady with dementia who came into the A&E department, and she couldn't talk, and the doctors and nurses were trying valiantly to do what they could for her. But the truth is, she shouldn't have been there. We should have had much better care in the community to help her, to stop her needing to go to A&E. And that's why, if I'm Health Secretary, if I could just say this, because I think this is the solution to this, if I'm Health Secretary after the election, the biggest change we will see is a dramatic improvement in the community facilities, the services offered through GPs.
Okay, but
so
briefly,
that we can help people to stay healthy and well.
But briefly,
without needing to go to A&Es.
I want to get as many people in as possible. Briefly, your organisational changes, according to the King's Fund, have, quote, contributed to increasing waiting times and declining performance.
Well, I would disagree with that, because what those organisational changes did was they took money from the back office, the huge bureaucracies of the PCTs. 20,000 administrators lost their jobs, and we used that money to hire 9,500 more doctors, 8,000 more hospital nurses, and this hospital's got 160 more nurses, which we are funding because we're putting money into the front line.
Your coalition,
I think we should just remember that, the system is under enormous pressure. I think we all recognise this, and it's a trend across the developed world, but the NHS is the best system globally, and it's something that we should be enormously proud of. But we now need more investment.
Well, you've had a whole parliamentary term to get that investment in.
Well,
did you fail to stop cuts under the Tories?
We've made extra investment. We're spending more on the NHS now than we did at the start of the Parliament.
But the pressure of social care has been a real burden, hasn't it, because of cuts elsewhere?
Well, yes, the system is under real pressure, but the point I wanted to make is Simon Stevens, the head of the NHS, says that by 2020 there will be a funding gap of about £8 billion. Hang on, let me just make the point. The Lib Dems have committed to meeting that funding gap.
And we're going to come on to the funding later.
We need all of the parties to do that.
I think
we'll come on to the funding issue later.
The point that I would make is that, why are all these extra people arriving at A&E? Why are people who are over 90, as Jeremy saw here, coming into A&E? And it's because care has been removed from their home. We've had these huge cuts to social care, and I warned both of these gentlemen at the start of this Parliament that if you cut social care, in the end, the collapse of social care will drag down the NHS with it.
The trend is exactly the same across the whole of the United Kingdom.
That's what has happened, Norman, throughout this Parliament.
OK, I'll come to you in one moment, I promise, but I do want to bring in Becky Platt, who is matron for Children's Services here at Watford. We've got a dispute here about what the causes are of the problems. Is it more people using the A&E, or is it too few staff, in your view?
I think it's definitely about more people attending A&E. We would normally expect to see about a 5% increase in our A&E attendances year on year, and actually over this last year we've seen over a 10% increase.
And what do you put that down to?
I think it's complicated. It's not only about social care, it's not only about GPs, it's more complicated than that. We've got patients with increasingly complex and complicated needs.
And more staff would help?
More staff would potentially help, but equally we need to get the flow right, we need to get the system right. It's not only about staff, and it's not only about one problem.
And we do need to be much better at stopping the crises from happening in the first place, which means better joined up integrated care in the community. But look, the pressure is intense, and I don't think the public want to see the NHS used as a political football. And what I'm arguing for is for all the parties to come together as soon as we're through the election, set up a non-partisan commission to come up with a new settlement for the NHS and the care system, and to work out ways of ensuring that it is sustainable. It's too important to knock it around in that way.
Let me bring in Mark Hanson here, because for UKIP, your immigration spokesman says that the number of immigrants, the sheer scale of immigration, is putting a strain on hospitals. But without mass immigration, you would have staff shortages, wouldn't you?
Yes, we might. But we would allow those people to come in. But what I would like to talk about is...
well, if you could just address that point, though, because you're wanting to curb immigration, but without those immigrants, 11% of NHS staff are non-British.
What about the general practitioners? These people, we pay these paid general practitioners. Why do they not have surgeries where people can be seen by their general practitioner in the community? The reason is that it's so difficult for some of them to get appointments that they have to come to casualty. So
Jeremy,
what are we doing about that?
It's happened on your watch.
No, and I agree with Mark, and you can't solve all the problems in one Parliament, but I think general practice is the key. And this is about people being able to see their GPs in the evenings and weekends. We've said that we want to roll that out to the whole country, but it's also about something different. We have a lot of people...
Well, hang on, it's got worse on your watch there, hasn't it? Andy Burnham, what do you make of that?
I want to explain what the problem is.
They removed a guarantee that we had, a 48-hour guarantee for people to see a GP. And
it drove GPs crazy.
Well, but it was good for the public. It was good for the public. The thing is, ever since then, waiting times have got longer. People are ringing the surgeries, they can't get appointments.
Can I just say
that's the problem. And they've cut the GP... Wait a second, they've cut the GP budget. So Jeremy says he now wants to invest in community services. Well, they've been spending a whole Parliament disinvesting in mental health and community services and social care.
I met a brilliant group of GPs down in St Austell in Cornwall last week, and a group of practices came together, and they're planning to set up one centre where you can be seen on the same day, and then another centre where you can deal with people with longer term conditions. That sort of change in the way general practice works, I think, can start to address the problem.
Can I just make this point, Catherine?
I'll have to come back to you after the break, because we've just got to take a break now, but we will continue the debate afterwards. Look, Andy Burnham, Shadow Health Secretary first. The poster that Labour's just put out saying next time they'll cut to the bone, they being the Tories. Actually, the Tories have increased NHS funding in real terms. That's what they said they'll do next Parliament, and that's what they've done this Parliament. That's pure scaremongering, isn't it?
Not at all, because I'm talking about social care. I've warned about it consistently, and the budget last week was described by the OBR as a roller coaster. What they mean is there'll be even deeper cuts to social care in the first 2 years of the next Parliament. Now, in my view, the cuts have already caused the A&E crisis. If we have these even deeper cuts, they'll entrench that crisis across the NHS. We're not spending money properly, Cathy, in the NHS. I'll take the point about waste. We're not spending a few pounds supporting older people properly in their own homes. We're doing these useless 15-minute visits, only to spend thousands of pounds keeping people unnecessarily in hospital beds, as we saw on your film at the start of this discussion.
Jeremy Hunt.
Well, I don't agree with Andy on this, and you know, if he actually listened to what was said in the budget last week, they said that if we stick to the plan, by the end of the next Parliament, we will see the biggest increase in public spending across all services, you know, including social care, in a decade. But you get that if you stick to a plan, and I think the biggest worry now...
Deep cuts to local government spending means that the NHS is having to shoulder more of the burden of social care, and will do increasingly.
And I agree with Andy that there is a strong link between what happens in the social care and the NHS, but I think it's also important to say that Labour have said there isn't any extra money for local government, and I think the biggest risk to NHS funding now is if we tear up the plan. This is, in the end, the most important question we can debate this evening. The NHS needs £115 billion every year. Now, let me just finish this point, Cathy, because you didn't let me finish before.
Is this how it works in the Cabinet?
We actually have very good discussions, but it's £115 billion a year. We have an economy that is now generating 1,000 jobs every single day. All those jobs are paying taxes, companies are paying taxes, and that means we can look to a future where, with the ageing population, we can actually put more money into the NHS.
Let's let Norman Lammin know.
So the most exciting thing, Cathy, in the budget last week was £1.25 billion to transform children and young people's mental health over the next 5 years. Nick Clegg negotiated and secured that. And that will make a massive difference to people's lives.
Cut it for 5 years, Norman.
We
You've been cutting children's mental health. Why?
But Cathy,
well, I'll answer that point though.
We haven't. The problem in the way the system works is that there is a complete imbalance.
Are you saying you've not cut mental health in this Parliament?
Let me answer the question.
I can give you the facts on this, and I just want to say I think no one has done more than Norman on mental health. And it's actually been a very good example of the coalition. And the mental health budget, Andy, has not been cut.
Well, can you justify that, Andy?
In real terms, and we can show you the
real
numbers.
Terms cuts to the mental health budget.
If I can,
There's absolutely no doubt about it.
Cathy, if I could just explain before Andy interrupts me. In the last Parliament, under the Labour government, they introduced a whole load of waiting time standards, but they left out mental health, and that dictates where the money goes. So mental health will always lose out. And I'm really proud of the fact that we are introducing the first ever waiting time standards in mental health from this April, and it will make a massive difference. But all parties need to commit to that £8 billion gap.
Mark Hanson, you commit to the £8 billion?
We're free at point of use, fully funded by taxation. That's the first thing. But secondly, we need to cut out waste. You go into large hospitals and there's dozens and dozens of managers. What do they do?
Okay.
What use are they?
Okay, let me bring in Kate Andrews at this point from the Adam Smith Institute. Are any of these promised extra billions, I mean it ranges from 2 billion to the full 8 billion from the Lib Dems, are any of them going to do the trick for the NHS?
Well, everyone's promising billions, and I still haven't heard exactly where they're coming from. But at the moment, everyone wants to be the party of the NHS because that's politically popular a couple months before an election. But back in January, the European Health Index for consumers put the UK's health provisions at number 14, just within Europe. Not number 1, number 14. And everybody who came before the UK had better patient outcomes. They had lower waiting times, shorter waiting times, and most importantly, in my opinion, they drew a distinction. They knew that government should be there to make sure that there was funding for healthcare for everybody, from the people who need it most to the people at the top. But they also knew, for the most part, that government was not the most efficient body to provide those services.
Yeah. Well,
and this is what I want to put to the panel. If it is the case that the UK citizens can get better healthcare if it's provided by someone else, why aren't we talking about it?
I reject that entirely. I mean, you're running a free market analysis there. The UK, the NHS, is the only healthcare system in the G7 that provides comprehensive healthcare to everybody of a decent standard for less than 10% of our GDP. If you look at the US, they spend double that. They
We're
spend
not talking about the US.
19% of their GDP on their health system.
We can't hide behind my
the
accent.
NHS
We're going to talk
has gone
about
backwards
Europe.
in recent years, but it is still, in my view, the best health service in the world.
Satisfaction in the NHS
Okay.
went up by 5% last year. Commonwealth Fund identified it as the best system globally last year.
But it doesn't
Okay,
have
but
to
wait
be
a
have a
second.
long way
Let
to
me
go.
just
We need to
put
make
to
the
Andy
best of it.
Burnham. Your colleague Liz Kendall says what matters is what works. It doesn't matter who provides it, it's whether it works. Better outcomes for patients.
And he disagrees with her.
My view is that if you look around the world, market-based healthcare systems cost more, not less, than national systems like the NHS. And I believe the evidence is clear that they add complexity, they add cost, and also they deliver fragmentation of care when the future demands integration of care. I make no apology for it. I believe, Kathy, in the public NHS, a service that puts people before profit.
Okay, we're running short of time, so let me just put David Lloyd. You're a GP and a staunch Labour supporter, but I believe you think the private sector role, you're happy for it to be increased. Is that right?
I think that's absolutely right. I think we must look for the best providers and the best commissioners. The NHS are very good at commissioning, perhaps, but what we really need is good providers, and it really doesn't matter who provides them. We need the very best that we've got.
And the extraordinary thing was, Kathy, that
Very
at
briefly,
last election, Andy actually offered patients the choice of any provider.
Quick response,
Now they're
Jeremy
taking
Hunt.
that away.
Here
response,
is
please.
the danger and the privatisation thing, and it goes back to the poll that Victoria showed us. For the public, it's not about public versus private, it's about good care versus poor care. And the danger of this danger of this debate, we were having this debate when your party was in power, Andy, and
Very
the fact
briefly,
is
please.
that we didn't notice mid-staffs was happening 4 long years, terrible care. That's what we need to be looking out for. That's what
Jeremy
doctors and
Hunt,
nurses
I'm
in the
afraid
NHS want.
I'm afraid we've got to end it there. I have a feeling the debate could go on all night, but that's all we've got time for tonight.